السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا مراجعة أسئلة اختبارات البرومتريك. Review of Prometric Test Question. This is lecture number 2 in leadership. Today, inshallah, we're going to discuss 10 questions from question number 182 up to question number 191. معكم محمد الثاني. نبدأ مباشرة. Question number 182. A nurse manager is preparing and writing a plan for dealing disaster. Code red. Which procedure is the top priority for the nurse manager? The options are number A, infection control, number B, staff orientation, number C, patient education, number D, patient relocation. وقف الفيديو هنا واختار الخيار تشوف الصحيح. The correct option is option number B اللي هو staff orientation. ليه اخترنا الخيار رقم B؟ نشوف rational. It is highly important that all staff know their rules and responsibilities before a disaster occurs. المفروض أي شخص يعرف مهامه ودوره قبل ما يحصل الكارثة. ليه؟ Because there is a little time to read a policy and procedure when a disaster actually does occur. Therefore, the top priority for the nurse manager is staff orientation. المهم جدا إنه الستاف أو الممرضين يعرفوا دورهم ومهامهم أثناء ما يكون في كارثة أو يكون في أي مشكلة. فبالتالي دي correct option. Regarding to the option number A, infection control is not related to question topic. ده ما عنده علاقة بالcode rate or disaster management. And regarding to the option number C اللي هو patient education is less priority, أقل أولوية وأهمية من staff orientation. And regarding to the option number D, patient relocation is implementation stage. So the correct option is option number B, which is staff orientation. Question number 183. Nurse manager was not happy about low result of patient's survey. Which of the following is the first step for nurse manager? The options are number A, schedule meeting with staff. Number B, start change to improve. Number C, review evaluation details. Number D, report to director. وقف الفيديو هنا واختار الخيار اللي تشوفه الصحيح. The correct option is option number C, which is review evaluation details. ليه اخترنا الخيار رقم C؟ نشوف rational. Note the strategic word. لاحظ الكلمة الاستراتيجية موجودة في السؤال. First معناها في second وفي third وفي fourth وكده. طيب. Use the steps of nursing process. استخدم في السؤال ده خطوات العملية التمريضية. And remember that assessment is the first step. والassessment دائما بيكون الخطوة الأولى. طيب. The only option that address assessment is option number C. في الخيارات بتلقى الخيار اللي بيتناول موضوع التقييم اللي هو الassessment هو الخيار رقم C, which is the correct option. ده الخيار الصحيح المفروض نختاره. Regarding to the option number A, B and D, دي الكل عبارة عن implementation steps. دي الخطوات تجي بعد assessment. So the correct option is option number C, which is review evaluation details. Question number 184. A nurse manager assigns tasks according to the clinical competencies of the nurses. Which of the following is the management function? The options are number A, delegating, number B, evaluating, number C, planning, number D, controlling. وقف الفيديو هنا واختار الخيار شوف صحيح. The correct option is option number A, which is delegating. ليه اخترنا الخيار رقم A؟ نشوف rational. Delegation is a process of transferring performance of a selected nursing task to an individual who is competent to perform that specific task. هي عملية نقل أداة مهمة أو مهام من شخص إلى شخص آخر له الكفاءة أن يقوم به، ودائما بيكون من الرئيس إلى المرؤوسين. It is clear from the question that the nurse manager carried out the delegation process. لو رجعنا للسؤال فوق نلقى إنه رئيس التمريض قام بعملية التفويض، بحيث إنه قام بتحويل أو بتكليف شخص آخر على حسب الكفاءة إنه يقوم بعملية معينة، فبالتالي هو قام بعملية delegation. So the correct option is option number A. Question number 185. Postoperative patient who underwent an abdominal procedure requests a pain medication from the nurse and rates the pain at level 9. There are standing order for narcotic administration. When the nurse opens the narcotic box and performs a count, the number of pills remain in the box is different than the number of pills recorded on the sheet. What is the most appropriate initial nursing action? The options are number A, notify the nursing supervisor. Number B, write the finding on the narcotic sheet. Number C, administer the patient requested medication. Number D, identify the last nurse who used the narcotic box. وقف الفيديو هنا واختار الخيار اللي بتشوفه سهل. The correct option is option number A, notify the nursing supervisor. ليه اخترنا الخيار رقم A؟ نشوف rational. This incident needs to be reported to the nursing supervisor. يحتاج إننا نبلغ به رئيس التمريض الحادثة دي اللي هو حادثة فقدان الأدوية المخدرة. Because reporting allow for more analysis. بيدينا فرصة إنه نشوف الحاصل بالضبط شنو. And identification of potential error or legal problem. ونتعرف إذا كانت في خطأ أصلا أو في مشكلة قانونية. طيب. And who involved it؟ ومن المسؤول؟ So the correct option is option number A. Notify the nursing supervisor. And then after, the nurse can administer medication and write the incidents. Regarding to the option number D, identify the last nurse who used the narcotic box is inappropriate option. Question number 186. An 81-year-old bedridden patient in the geriatric ward was pyretic through his nasogastric tube. After an hour, the patient deep sleep, his breathing pattern changed, and he did not recall his name. Which of the following should be the immediate nursing intervention? The options are number A, call the physician to examine the patient. Number B, check for the correct dosage given. Number C, check vitals and inform physician. Number D, try to wake up the patient. وقف الفيديو هنا واختار الخيار بتشوف سهل. The correct option is option number C, which is check vitals and inform the physician. ليه اخترنا الخيار رقم C؟ نشوف rational. Note the strategic word immediate. Use the steps of nursing process and remember that assessment is the first steps. استخدم خطوات العملية التمريضية وتذكر إنه الأسسمنت دائما بكون أول خطوة في خطوات العملية التمريضية. The only option that address assessment الخيار الوحيد اللي بيتناول التقييم is the option number C وهي ال correct option اللي هي اخترناها هنا. طيب. So the correct option is option number C. Check vitals and inform physician. Option number A, B, and D address the implementation. Question number 187. The nurse in the male medical unit took a signature from a patient who needs an abdominal CT with contrast. What is the best nursing practice? The options are number A, consent should be taken after the procedure. Number B, verbal consent is acceptable for these procedures. Number C, consent should be taken from the patient relative. Number D, consent should be taken according to the organization. وقف الفيديو هنا واختار الخيار شو سهل. The correct option is option number D, which is consent should be taken according to the organization. ليه اخترنا الخيار رقم D؟ نشوف راشد. بنستخدم استراتيجية الإزالة elimination process عشان نحل السؤال. طيب first eliminate option A. ليه؟ because consent should be taken before the procedure, not after the procedure. And eliminate option B also. ليه؟ because a written informed consent is required for non-surgical procedures that cost more than slight discrepancy. حتى لو إجراء غير جراحي، لكن فيها بعض المخاطر زي الرياكشن ممكن تحصل في الإجراء بيطلب منها توالي informed consent. Eliminate option C also because consent must be signed by the client. المفروض يوقع المريض وليس الأسرة أو الأهل. without threat or pressure except في حالات معينة ممكن يوقع عنه الأسرة أو يوقع عنه القاضي أو غيره. So the correct option is option number D, which is consent should be taken according to the organization. Question number 110. In the hospital digital dashboard, what types of data displayed? The options are number A, staffing, number B, financial, number C, performance, number D, knowledge base. وقف الفيديو هنا واختار الخيار اللي تشوفه سهل. The correct option is option number C, performance. ليه اخترنا الخيار رقم C؟ نشوف rational. A digital dashboard is a type of graphical interface that often provides a quick look at key performance indicators مؤشرات الأداء that are relevant to a specific goal or business process. هي لوحة تعرض فيها مؤشرات أداء بتاعت العمال أو بتاعت المؤسسة أو بتاعت المستشفى أو غيره. So the correct option is option number C, performance بمعنى الأداء. Question number 189. A new nursing director assigned to a hospital. That is the first should he do. The options are evaluate the staff, change the head nurses, change the roles, nothing to do. وقف الفيديو هنا اختار الخيار اللي تشوف سهل. The correct option is option number A, evaluate the staff. اللي اخترنا الخيار رقم A نشوف rational. The responsibilities of directors of nursing are directing, توجيه, overseeing, مراقبة, and evaluating all nursing personnel وتقييم كل الممرضين. So the new nursing director should evaluate the staff first, which is the correct option. And then after, he can change a head nurses or change the rule. Regarding to the option number D, nothing to do is inappropriate. Question number 190. Surgeon instructs a nurse to serve as a witness to an elderly patient informed consent for surgery. During the explanation to the patient, it becomes clear that the patient is confused and does not understand the procedure, but reluctantly signs the consent form. The nurse should do the option number A, sign the form as a witness and making a note that the patient did not appear to understand. Number B, not sign the form as a witness and notify the nursing supervisor. Number C, not sign the form and answer the patient question after the surgeon leaves the room. Number D, sign the form and tell surgeon that the patient does not understand the procedure. واكتب الفيديو هنا واختار الخيار choose. The correct option is option number B. Not sign the form as a witness and notify the nursing supervisor. ليه اخترنا الخيار رقم B؟ نشوف rational. Informed consent أو الموافقة المستديرة is a dialogue between the patient and physician in which the patient learns يتعلم and understand يفهم about the proposed treatment and العلاج المختار including the risk المخاطر benefit الفائدة and alternative والخيارات إذا وجدت. And the patient also has an opportunity to ask questions in the person يسأل and agree about what is to be done وبعد ذلك يوافق على المفروض يتعمل شنو. And the nurse witness the signature and gives their signature to verify patient understand. توقيعك يعني إنه أثبت إنه المريض كان فاهم الإجراء المفروض يتعمل. Therefore the nurse should not sign لذلك ما المفروض يوقع الممرض على الموافقة المستديرة unless he verifies the patient understanding. إذا تأكدت إنه المريض فاهم الإجراء من A to Z. So the correct option is option number B, which is not sign the form as a witness and notify the nursing supervisor. كل رئيس التمريض بالحاسب. طيب. Question number 191. A community nurse assigned to work in Mecca, one of the most multicultural cities in Saudi Arabia, has to interact with multicultural population every day. What is the most important step the nurse should do before with the client? The options are number A, asking the client about his or her cultural background. Number B, conducting an appropriate culturological assessment. Number C, ensuring that the client has his or her privacy. Number D, looking at the client file to take a history. وقف الفيديو هنا واختار الخيار الشوسي. The correct option is option number B, conducting an appropriate culturological assessment. ليه اخترنا الخيار رقم B؟ نشوف rational. Note the strategic word important step. مجرد ما تلقى كلمة استراتيجية من النوع ده important step, first step, second step, initial action طوال استخدم معه خطوات العملية التمريضية. Use the steps of nursing process and remember that assessment is the first steps وهو important steps في خطوات العملية التمريضية لأن كل الخطوات بيبنى. So the only option that address assessment is the option number B, which is the correct option اللي هو conducting an appropriate cultural assessment. شكرا جزيلا. نتقابل إن شاء الله في محاضرات قادمة. Don't forget to support us by comment, like or subscribe. مع السلامة.